This is a demo for the pediatric multisystemic syndrome to be reviewed for content. And yes, I need a haircut and have to shave. Hi there, it's Dr. Marv from Highland Pediatrics. I wanted to chat about a developing condition called PIMS that has been in the news lately. PIMS, or Pediatric Multisystem Inflammatory Syndrome, is being studied in connection with COVID-19. So what do we know about it? We know that this process is similar to two conditions we already study in our first years of medical school called Kawasaki's disease and toxic shock syndrome. These two conditions are not new to us as medical providers. In fact, we already routinely ask questions to specifically screen for these conditions during our visits together. We have experience in diagnosing and managing these conditions through our training in the intensive care units, emergency rooms, and everyday office visits. While the definition of PIMS is unique to COVID-19, the overall features of it are not new to us. So what is PIM? The condition is called multisystem inflammatory syndrome in children, or MIS-C, or as I've been referring to it, pediatric multisystem inflammatory syndrome, or PIMS. This is a condition in which 4 to 6 weeks after one is sick with COVID-19, they can develop a grouping of symptoms such as a fever that won't go away, abdominal pain, diarrhea or vomiting, rash or changes in skin color, trouble breathing, confusion or being too sleepy, conjunctivitis, lymph node swelling, sore throat, swollen hands and feet, or passing out. In our general experience with multisystemic inflammatory conditions, there are usually just more than one symptom. So how common is it? Well, Kawasaki's disease and toxic shock syndromes are actually on the rare side. At Highland, we maybe see one case of Kawasaki's disease a year. And regarding to PIMS, among the 343,051 patients diagnosed with COVID in New York City, there were reported 110 cases of PIMS. This results in 3 cases for every 10,000 people diagnosed with COVID-19. Let's bring it closer to home. As of May 15, 2020, for all of the 5,444 people diagnosed with COVID-19, there would be 1.6 cases of PIMS. Of the total cases of coronavirus in Massachusetts, only 53 children under the age of 18 have been hospitalized, and Massachusetts has not reported any pediatric fatalities connected to COVID-19. As a physician and a member of the Brown University Medical Teaching Faculty, I am committed to educating and caring for our children, and I'm confident the children in our community will be safe. If you are concerned about PIMS or anything else regarding your child's health, please reach out to your doctor's office. At Highland, we have developed a variety of ways to care for our children, including visits via your home computer and at the office. From the Highland Pediatric family to yours, please stay safe.